My name is Nataliia Karpenko. I'm founder and CEO at Livzo. Livzo is a chronic disease management platform to empower life of patients with chronic disease. I would like to share with you my personal story. At the age of 6, I was diagnosed with acute kidney disease, which meant a lot of changes to my life and life of my family. My mother, she has to quit her job to manage my ongoing stays at hospital to help rejuvenate her child. I have to adjust my diet. That was very challenging and difficult. And there are a number of other changes I have to compromise to be able to stay balanced. I'm not alone with this disease. There are another 26 million people in the US suffer from chronic kidney disease. So imagine your water filter. You buy a new water filter, and it filters your water really well. Over time, as more filtration you do, or as maybe your water is not that clean at your home, your filter performs worse. So quality of your drinking water declines. So same as kidney for our body. They perform filtration function to our blood, removing additional fluids, waste, and toxins. So people who suffer from chronic kidney disease, the quality of their body filtration system declines. So kidney actually can fail completely. And those patients, to be able to survive, they have to go to dialysis. It's a difficult adjustment. Besides this, more than 50% of all dialysis patients have higher toxins, unbalance of potassium, phosphates, life expectancy only 5 years. Dialysis machine cannot replace healthy kidney. So for patients who have to adjust to the new lifestyle, they have to attend dialysis. And they have to manage their diet because their filtration system cannot do it well. So complex diet is very challenging because the food labels don't provide amount of potassium, phosphates. So many of those patients have already comorbidities like diabetes. So that frustration leads to noncompliance. There are 486,000 people live in the US with a renal failure. If patient doesn't comply, they go to hospital. And that's why we have the highest hospitalization rate between renal patients, $43 billion cost per year for US healthcare system. Now I'll take you out of the lesson about kidney disease and ask you a simple question. What can I eat now? Unfortunately, for dialysis patients, decisions are very different. Unfortunately, for dialysis patients, that is very dangerous. It has more than daily number of phosphates. And basically, a patient cannot eat anything for this day anymore if they eat this meal. Majority of patients don't know. So with our technology, we're able to provide better decisions where the patient going to fast food, doing healthy shopping. So in this case, we provide a recommendation, hamburger will be 4 times better for this patient. Anytime patient making decisions, whether in restaurant, fast food, or they're going to the grocery shop, or they may be already adhering to great plan as they're just looking for right recipes, we have a personalized renal comorbid recipes for them. Their diet changes, they're not happening alone. They're very much dependent from family, community, and our culture. So that's why we built entire technology around the needs of diet and community, where a patient can be better connected to the peer support, other patients who are facing similar issues, patients who achieve better results, connecting better with their social workers, patient education classes, and have it all handy in one device in real time. Of course, very important, getting additional assessments and helping patients managing their daily regimen, breaking their treatment plan for everyday adherence. So we're helping them to manage daily regimen in terms of their activity, stress level, quality of sleep, and also we're doing the vital tracking with medical-grade device. So that experience has to be rewarded. We're rewarded as consumers for everything else, but not managing our health, and write services to patients who in need by incentivizing them to use the platform for adherence. So we are truly there, providing a holistic experience for patients and being their companion every day, give them advice and guidance when they really need it, and provide those recommendation analytics back to the medical team to be more informed, helping patients to avoid unnecessary hospitalization, but also helping to guide patients when they don't have an answer and they just need a simple support and communication. We're providing also the right tools for the educators, social worker, to use their higher skills to really empower patients when they meet them in person. Simplicity of it could bring a better quality of life to the dialysis patients. Also, it can save cost on rehospitalization and impacting patients' mortality rate. And overall, it can optimize the cost for healthcare and helping dialysis units to do a better job managing those patients' life. How we differentiate? So we're building a truly personalized assistant that can utilize knowledge and recommendation from a medical team and build a pet proper companion for patient. We learn in patient behavior and insights. None of the solutions in the market addressing dialysis patients. It's not a sexy disease. Ultimately, we want to go to chronic kidney disease and helping patients who suffer from kidney failure, but adjusting their daily life, helping to prolong function of their kidneys, helping them live a better quality of life, never get to dialysis, or be way more informed and prepared for dialysis properly. And for chronic kidney patients, there is a $3.1 billion addressable market with our product. We are already speaking with DaVita, the venture arm, and they're very interested in our product. Beyond that, we're planning to go next to working with nephrology groups and hospital systems. We had many great discussions with Maine Health. Myself and my co-founder, Bob, we met more with 40 providers in Maine Health. We engaged a number of beta users, worked with them closely. One of them were Kaiser Permanente, group of 40 nurses. They did wellness program. We collaborated also with Hospital Association of Southern California, had more than 55 wellness professionals of hospitals adopting our platform and giving us feedback. We work also with in other institutions, one of them Canyon Ranch. I would leave you with the last note. So I've been working with Jeffrey Jones. He's one of the longest living dialysis patients in the US. And Jeff has shown incredible results because he's been managing his diet really well and he's been attending dialysis. He has a great family support and community. So with the knowledge of Jeff, I want to empower every patient to be able to have a chance, be a survivor on dialysis for 35 years. Thank you so much for your time. If you have any additional questions or feedback, I would really appreciate it. You can find me in the hallway and enjoy the rest of the pitches. Thank you.